I feel like we're starting to film erotic.
You want to put some music on? Set the mood?
I don't think so.
I can dim the lights. Oh, man.
All the lights stay on.
Alright, so we're going to do a little dry needling on Dr. Marc's upper track, his left side specifically. He's got some tightness up there, so.
So what would you normally do it for? Do it for pain, tightness?
So a lot of times we'll get people, like if they have like headaches, or if they have a lot of tightness, or maybe they have shoulder pain and they've got a lot of like soft tissue restriction. That's a lot of times what we do it for.
For in this area?
In that area.
But just generally for dry needling?
In general, I would say it's great for reducing like overactivity of muscles. So if you have like a muscle that's like very protective in nature, you know, maybe it's like an injury, like say like low back pain, but now you've got all these like, you know, paraspinal tightness, glute tightness, everything else is kind of like, you know, spasmed up because of, you know, the pain that you have underlying. It's great. It's more like soft tissue waste. You know what I mean? Reduce that tension. Sometimes some of those muscles are so deep, we just can't get to it on the surface. You know what I mean? So it really does creates this like twitch response that helps to reset neurologically the muscle, so that we can get a better. Not only we can relax the muscle, but we can then reintroduce it to load, so that we can, you know, kind of rehab it.
Okay, I'm ready.
Works well. All right, let's hit it. All right, try not to lay nice and flat here for me. A couple spots. Let's go check this camera. So you've never had acupuncture before?
No,
Okay.
I'm a picture of health.
That's fair, that's fair. All right, so the beauty of this is you don't even really feel it. However, when it gets inside the muscle belly itself, it feels like a little crampy. You're most likely going to get a twitch. The upper tracts tend to be a little active, which is not unusual. So if you do get a twitch, it's not unusual, it's normal. And then after we get the needles in there, they don't stay in there that long, but we will put some electrical stimulation on the needle just so that we can create a little bit more of a twitch response of the muscle. So I don't have to jam it many times.
Are you
It's
looking
always
for
nice.
a twitch response?
The twitch response is what we're looking for. Yeah, because that's what resets the muscle. So the muscle is overactive for, I think it's a couple reasons, whether it's chemically induced or electrically, we're not really sure. Either way, it's more of just like a reset to the nervous system. So it's like when your computer's running slow, you just turn it off, turn it back on again. And then that will calm the muscle down, and then what we'll do is we'll usually do exercises following to then kind of reintroduce some load into the muscle. Right, so let's pick one spot right up here. Twitch there.
Now, what are the reasons you wouldn't do this for somebody?
Who wouldn't I do it with?
Yes.
So obviously I wouldn't do it with anybody that is either fearful of needles, they have any type of like seizure or like epilepsy or anything like that. Even if they have like a pacemaker, I would do it, but I wouldn't do it with the stim.
Right.
That's a good one. But there's not like a lot of contraindication. We'll usually say that if somebody is in their first trimester of pregnancy, then we typically won't do it, and that's really just more of a CYA than it is for anything else. Because God forbid something happens in the first trimester, we don't want to be on the list. But other than that, there really isn't much of a contraindication. Or unless they're on like a blood thinner, or they have chronic issues. That's obviously a concern as well. But most people don't usually have that.
Now, what's causing it to twitch? Just the...
So if the muscle's overactive like that, we're hitting like an active trigger point.
Okay.
So yeah, that and it's not unusual for you to feel like a little referral pain too as well. Especially like if we hit the glute, like there are people that sometimes will kind of get radiating symptoms down the leg, which kind of similar to sciatic feeling. Pretty common. All right, so you're gonna feel a little twitch here from the machine. we usually use for like 15 seconds, 20 seconds tops. I usually say the only type of side effect that you're gonna get from this is like a little bit of soreness. It'll almost feel like you worked up your traps, but that feeling goes away within those 24 hours, which is nice. But the results with the dry needling are pretty immediate. Like if you're having pain up here, usually the pain will be diminished pretty fast. Or if like you're feeling a lot of tightness or a lot of overactivity, it's usually gone after the first session, if not the second.
Now the difference between this and acupuncture is you're putting it on the trigger points versus the meridian one.
Yeah, so this is more like soft tissue based versus like you just said, like meridians, pathways, that kind of stuff. Yeah, like I'm not gonna stick a needle in your earlobe or anything like that.
That's after hours.
Yeah, exactly. What is it, like the web space between your first and second tail and your earlobes? I think so, or maybe the web space in between your thumb and index finger. I don't know. They're like there's pressure points for sure. But with the upper trap, you only have to hit a couple spots because if you do too much, then it becomes really sore and it's not worth it. You got a pretty responsive first one. Probably just gonna do one more.
Because it's so big.
Yeah, exactly. I'll tell you, you're more active over here than you are over there, that's for sure.
I got jammed up gravel.
Did you really?
Yeah. So how long do you normally do the grass for?
Like 10 minutes, 12 minutes, something like that. All depends on the person. All depends on the area. Like this is feeling pretty good. Like I judge it based off how the tissue's feeling too. So it's definitely feeling a lot relaxed, which is kind of where I want it. We got some good blood flow here now too. So this would be the point where we do some, whether it be stretching, whether it be some strengthening exercises to kind of reinforce everything we did with the needling and the fasting. Feels good though. Grass can help with the soreness too.
Yeah, my biggest secret was trigger points.
Yeah. Yep.
I think it's the Travell and Simmons.
Yeah, Travell and Simmons. Yep, Travell and Simmons. You got it.
Yeah, that's the course that I took through Dave. That was basically how the trigger point diagram.
That stuff was better.
Yeah.